Hello, I'm Harvey Godwin Jr., Chairman of the Lumbee Tribe, and today we're here at the Stronghold, the Henry Berry Lowry House, home place. And with us today is a young Lumbee woman professional from the Prospect community who now lives in Pembroke, Dr. Jada Brooks. And she is assistant professor at the School of Nursing at the University of North Carolina at Chapel Hill. And in addition to that, she is a Thorp faculty engaged scholar. So Dr. Jada, how about telling the people today about some conversation about COVID-19 and your studies and research and what you can tell the people?
Thank you. As a native nurse scientist, I study racial disparities in health. Most of my research is focused on the environment and how it shapes the health of Native people. I'm particularly interested in heart health and have a current study examining exposure to air pollution and its relationship to cardiovascular associated inflammation in American Indian women in the rural Southeast. A reasonable question to ask is why I might be interested in COVID-19. The answer lies in its relationship to the immune system, whose role is to protect against disease. Multiple studies have found that breathing in polluted air causes an immune response that produces inflammation. Inflammation can jumpstart chronic diseases like heart disease. Inflammation can also trigger adverse cardiac events such as heart attacks and strokes. Now let's talk about COVID-19. In a recent nationwide study, Harvard researchers found that long-term exposure to air pollution was associated with higher COVID-19 death rates. In other words, people who lived in more polluted areas are more likely to die from COVID-19. Sadly, air pollution hits harder in communities of color, which is especially concerning since persons of color tend to have higher rates of chronic conditions like heart disease compared to whites. Individuals with underlying medical conditions are more vulnerable to COVID-19 and are at higher risk for severe illness if infected with the virus. What does all of this mean, and what can the Native community do to protect themselves? Let's discuss the first question. We know that there are pollutants in our immediate environments that can contribute to the risk of disease. They often compromise our immune system, so when a virus such as COVID-19 comes along and produces a cytokine storm, our bodies have a harder time fighting off the infection. If you add an underlying medical condition to the picture, the outcome becomes even bleaker. Let's turn to the second question about how the Native community can protect themselves from COVID-19, as well as future pandemics. By now, we should all know about hand washing and social distancing, which are optimal measures in preventing the spread of COVID-19. Beyond these measures, the best protection to the Native community lies in creating a healthy and active immune system that can guard against foreign invaders like environmental pollutants and viruses. The great news is that there are lots of ways to boost the immune system and improve overall health. The even greater news is that many of these immune boosting measures are traditional to Native culture that predates Western colonization. If you can create a healthy lifestyle, you will give your body the best chance to fight environmental pollutants and illness. You might be wondering how to create a healthy lifestyle. First, drink more water. Staying hydrated boosts your immune system and overall health. Second, quit the habit of smoking. Not only does smoking increase your cancer risk, but it also weakens your immune system. Third, limit alcohol intake. Excess alcohol intake can deteriorate the immune system. Fourth, get your shots. Immunizations are a proven way to boost immunity and are especially crucial for children and elders. Fifth, eat a healthy diet. A healthy diet includes whole plant foods, good fats like nuts, and fermented foods like yogurt. These types of foods contain nutrients and vitamins that are essential for the immune system. It helps to also limit added sugars in the diet, which are high in processed foods and sodas. Sixth, get regular exercise. Regular exercise guards the body against infection. Based on current guidelines, you should get in at least 150 minutes of moderate intensity activity like brisk walking or running every week. If you have an underlying medical condition or have past injuries, be sure to consult with your healthcare provider before beginning a new fitness program. Seventh, get sufficient sleep. Lack of sleep or too little sleep can activate an immune response and weaken the immune system. Be sure to stick to a regular bedtime schedule, which will help keep your circadian rhythm in check. Eighth, get outdoors. Natural light helps your body make vitamin D, which helps the body produce antibodies. Take a brisk walk or garden. With some sunlight, fresh air, and movement, you will immediately feel better. Ninth, stay connected. Having a supportive social network is beneficial. Just remember to practice physical distancing of 6 feet until advised otherwise. 10th, have a laugh or find humor in life. Not only will it make you feel better, it will also strengthen your immune system. 11th, use herbs and supplements such as echinacea and elderberry. If you are taking medications, discuss with your healthcare provider before starting to avoid potential interactions. And the last, but one of the most important ways to create a healthy lifestyle is to reduce your stress levels. Chronic stress increases inflammation in your body and impairs your immune system. Many of the lifestyle changes we've discussed can lower stress levels. Others include prayer, mindfulness practices like deep breathing or meditation, and cultural practices such as drumming, dancing, beading, or quilting. You may already have a healthy lifestyle. If so, that's great. Use the time we've been gifted by COVID-19 to keep up the excellent work. Others of you might feel overwhelmed by having to adopt lifestyle changes, or just don't know where to start. That's okay. Just start with one and be consistent. Most importantly, remember the 21-90 rule. It takes 21 days to create a habit and 91 days to create a lifestyle. Just remember, the best way to protect yourself against environmental pollutants and nasty viruses like COVID-19 is to strengthen your immune system. A healthy immune system can ward off illness and help you stay healthy for years to come.
Dr. Jada, thank you so much for joining us today here at the Stronghold. Your words and advice will ring true for our people for the weeks and months to come, and hopefully will keep us all safe. God bless you for what you're doing in your medical career, and thank you for representing the Lumbee people in such a profound and strong way. We're proud of you. Thank you.
Thank you.